Hello, my name is Dr. Eric Johnson and I am a general and colorectal surgeon. In this video we're going to talk about colon cancer briefly in terms of the symptoms patients may have, the way that we evaluate colon cancer, and the way that we treat colon cancer. Colon cancer is the third most common type of cancer in the United States and the second most common cause of cancer death in the United States. So it's a very common type of cancer, and we see a lot of it in general surgery and gastroenterology clinic. Most people that present with colon cancer have symptoms of a change in bowel habits such as bleeding, diarrhea, weight loss, or abdominal pain. Frequently stools may be changed in either color or character, such that people are going more often than they did before, or they notice that their stools are more narrow than they were before. Also, just a change in appetite or just weight loss is another concerning symptom. When people have those types of symptoms, we usually start by performing a colonoscopy, and that test involves putting a thin camera into the intestine and looking throughout the whole colon for any growths such as polyps, which are precancer growths, or lesions that are concerning for an actual colon cancer. Either myself or a gastroenterologist that performs that test will try to remove all of the polyps that we see so that they don't grow into a cancer. If unfortunately you have a colon cancer diagnosed, then the next step that we do is a CT scan, usually of the chest, abdomen, and pelvis. The reason we do that is because we want to know if the colon cancer is just within the large intestine itself, or if there's been some spread of cancer to other parts of your body, such as other organs or lymph nodes in the body. Once we have that test done, there's also a blood test that we perform called a CEA test. And that test is really more for following people after surgery. It's sort of like a PSA or a prostate lab, where we follow people after surgery, and if it's rising after we remove the cancer, it makes us want to look for the cancer coming back. So after we have the colonoscopy with a biopsy that shows a cancer, the blood test, and a CT scan, we very often proceed to surgery as the next step. In surgery, we can perform removal of the colon cancer either laparoscopically, meaning using small incisions, or sometimes an open procedure, which is a larger incision on your belly. We're able to remove the cancer and make a new connection with the intestine so that the GI tract is back in continuity, and people recover in the hospital, usually in the range of 5 to 7 days after surgery. After your colon cancer has been removed, we follow people with CT scans and additional colonoscopies to make sure that the cancer hasn't come back in the same location, or people have other areas that are concerning for new growths. If you have any additional questions, you can contact us at BayCare Clinic. There are a number of good resources on the internet. The American Cancer Society is one excellent website. Also, the American Society of Colon and Rectal Surgery also has a lot of information for patients. Thank you for watching today.